How does family accommodation impact OCD? How does family accommodation affect someone living with obsessive-compulsive disorder? Family accommodation refers to the ways family members adjust their behavior to help a person with OCD avoid distress or compulsions. While these actions may seem supportive, they can have significant negative effects on both the individual and the family as a whole. When family members engage in accommodating behaviors, such as providing reassurance or helping to avoid feared situations, they may unintentionally reinforce the cycle of OCD. This can lead to a temporary reduction in anxiety but ultimately prevents the individual from facing their fears and resisting compulsions. Over time, this reliance on family support can make it harder for the person to develop coping strategies and increase their dependence on these accommodations. Research indicates that higher levels of family accommodation are linked to more severe OCD symptoms and poorer treatment outcomes. This is particularly concerning because effective therapies, like exposure and response prevention, requiring individuals to confront their fears without engaging in compulsive behaviors. When families accommodate these compulsions, it disrupts the effectiveness of treatment and prolongs the disorder. Family accommodation does not just impact the individual with OCD. It can also create stress and conflict within the family. Family members may experience emotional distress, leading to criticism or overinvolvement. This can create a cycle of dysfunction that complicates managing OCD and affects overall family dynamics. To address these challenges, many therapeutic approaches now incorporate family-based cognitive behavioral interventions. These interventions aim to reduce accommodating behaviors while supporting the loved one with OCD. Families can learn to recognize and limit their accommodating actions, which can help promote healthier family dynamics and improve treatment outcomes. Families can support their loved ones by encouraging evidence-based treatments like exposure and response prevention. They should seek education on how to respond constructively to OCD symptoms and consider joining support groups to manage their own emotional well-being. In summary, while family accommodation often comes from a place of love and concern, it can ultimately sustain OCD symptoms and hinder recovery. Addressing family accommodation is essential for effective treatment and fostering a supportive environment for everyone involved.